With mass shootings seeming more prevalent, such as the events at Sandy Hook Elementary and the Batman premiere at the Denver Theater, our Fallon Glick is taking a look at the history and funding of mental illness in part one of Minding Mental Illness.
At a time when mental health issues have been brought to the forefront, there is still not a lot of public knowledge known about this almost invisible disease in terms of its history and funding. And by understanding its past, it can give us better insight into the illness.
I mean, what do you think you are, for Christ's sake? Crazy or something? Well, you're not.
Since the 1800s, people suffering from mental illness have been stereotyped as lunatics or crazy, like in this scene from One Flew Over the Cuckoo's Nest.
Long ago, those folks would be really put into something that looked like a prison.
Ohio at one point had 17 state hospitals treating over 25,000 people, and there was really no effective treatment. Christina Ryan Claypool herself was in and out of the Toledo State Mental Hospital. She was admitted for such extreme depression, which caused her to be suicidal, and she remembers her time there all too well.
There was what I call an us and them mentality, very much maybe looking down upon. I remember those days. It was incredibly painful, incredibly emotionally painful, and you felt very bleak and hopeless and very frightened.
Claypool feels blessed that she was so young at the time and didn't have to endure treatments like shock therapy. Today, treatment facilities and medications have improved tremendously, allowing people to live more full lives without adverse side effects.
I was on a lot of different kinds of psychiatric drugs. Some had severe side effects, some caused seizures.
There's a lot more work done on medications that are more specific. So there's medications that treat specific disorders like bipolar disorder, depression.
For as many barriers that are being brought down in terms of treatment, there are new obstacles to face in terms of funding.
Do I think we have enough money to serve the individuals that are in need in our community? No, we don't.
In our area, just in our 3 counties, Allen, Auglaize, and Hardin counties, we lost over $2 million of funding, which is about a fifth of the funding that was already not in good shape.
Many high-profile shootings, such as Sandy Hook Elementary and the Denver Theater, have brought mental health issues to the forefront. To address the issue, Governor Kasich approved $5 million to develop crisis intervention programs for young people with mental illness.
There's that small group of people who, untreated, also have violent tendencies, and that's why having treatment is so critical.
Schoenhofer says there is an unfair connection between mental illness and violent behavior. Studies have shown that those suffering from mental illness are usually the victims of violence and not the perpetrators. Fewer than 10% actually have violent tendencies. In the studio, Fallon Glick, your news now.
It's not always easy for people suffering from mental health issues to find employment. Fallon Glick gives us a look into how one woman is making ends meet in part 3 of Minding Mental Illness.
Finding a job these days is hard enough, but throw mental illness into the picture, well, that almost seems impossible. But the stigma behind their capability to work is slowly disappearing.
I called people mornings, evenings, nights. I didn't give up, even though I got frustrated when they said, we ain't hiring.
Jamie Grigsby, who suffers from anger and addiction problems, had been vigorously looking for a job for nearly 2 years.
People just look at you different.
Sorry. No, it's okay. Although 25% of people in the workplace have had a form of mental illness in their lifetime, employers can be hesitant to hire because they may need special treatment.
People with mental illness may require special adaptations or may not be able to work in the morning. Sometimes people with mental illness have difficulty in the morning. They may need a flexible schedule.
She believes she got the help she needed from Coleman Services at the very last minute when she needed it most.
When the individual is stable, we try to introduce skill trainings, specific skill training so they can get hired, and then skill placement or skill experience to provide the actual job.
I got the help. I took the classes I needed to take and got the extra help on the side too, and just they became like my family more than my own family did sometimes.
After all the hard work she put in, she finally got a call from the Howard Johnson Hotel.
I started crying like I'm about to now because it was just exciting, that's all.
We wanted to give her a second chance, especially when we brought her in for the interview. She had such a great personality, and people can change, and it's really been a good situation for us.
She has been cleaning rooms there for a few months now, and the hotel couldn't be more pleased with her performance.
Anybody can come in here and learn how to clean a good guest room, but it's the interaction she has with the guests when they're checking out, and her personality, just she goes above and beyond what we could expect of her.
Getting this job has been a turning point in her life, and she's now taking online classes to get a degree in business management.
Looking ahead, funding for mental illness may soon see an increase. Governor Kasich is expected to give his point of view on the issue during his State of the State address. If he chooses to expand Medicaid eligibility, it would further improve access for those suffering from mental illness. If legislation approves of the expansion, it will take effect in January of 2014. In the studio, Fallon, Glick, your news now.